My name's Katrina and I've recently returned to practice after nearly 10 years of being away from dietetics. I felt the time was right to pursue my career and my dream of returning to practice. I was surprised at how easy the whole process was and the level of support that was provided along the way. I firstly contacted the HCPC, who were extremely helpful and explained the whole process and the length of time that was required for clinical supervision and private study to enable me to gain back my registration. I spoke with the dietitian involved in the return to practice, and she sent me various paperwork that looked at my previous experience, my current knowledge and any areas that I felt needed improving. I was also directed to the Health Education England, who are responsible for helping with funding of £800 for returnees to use with private study, clinical supervision or formal study. A timetable was then devised and tailored to meet my needs of 30 days of clinical supervision, and bearing in mind and taking into account my outside work commitments and childcare commitments. My whole experience of returning to practice has been a mixture of nerves and excitement. I spent my time with the community dietitians, visiting various hospitals in the community and holding clinics, seeing patients, looking at nutritional assessments, dietary care plans, feeding regimes. I would check in regularly with my supervising dietitian just to provide any support, any feedback that was needed. I found this was extremely helpful. I think some of the challenges that I faced returning to practice was possibly the time management, trying to get the time to fit in the private study around outside influences of childcare. But I overcame this by managing my time as effectively as I can and drawing up a timetable, and this really helped. Also, I did find the computer systems, these could be quite tricky to navigate around, but again there was online courses that were available, and using these systems daily helped me to practice. I'm so pleased and I've really enjoyed my whole return to practice. I'm now currently working as a Band 5 dietitian here at the Royal Cornwall Hospital. The team are so friendly and continue to provide so much support. I love the fact that we work autonomously and as part of a team with the allied healthcare professionals. Every day is different, working with family members, patients, carers, the medical team and the therapy team just make this job very rewarding and a special job as a dietitian.